Welcome back to the deep dive. Today we are tackling something that is simultaneously the most microscopic subject we've ever covered and quite possibly the most monumental shift in the history of medicine and, well, biology itself. We're talking about the robots inside you.
Robots is a strong word, but, functionally, it's really accurate. I think that's the perfect place to start because it just reframes the entire conversation.
Right. I mean, when I was reading through these sources, that is the image that kept popping into my head. We tend to think of our bodies as these, I don't know, squishy biological bags of water and bone.
Yeah.
But if you zoom in way, way down to the molecular level, we're essentially run by billions of tiny molecular machines.
Which we call proteins. But you're right, calling them proteins almost does them a disservice because most people just think of a steak or, post-workout shake.
Exactly. I'm guilty of that. I see protein on a label and I just think macros. But we are not talking about nutrition today. We're talking about the workers, the little engines.
That's it. Every single important job in a living thing. From the way your eyes detect light, to the way your blood carries oxygen, to the way your immune system fights off a flu. It's all done by proteins.
They're doing all the work.
All of it. And if you could see them, you'd see gears turning, levers pulling, tiny little motors walking along tracks inside your cells. They are machines.
And for the longest time, the history of biology was essentially us just trying to observe these machines like we were bird watchers.
That's a great analogy. We'd find a protein in nature, look at it through a microscope, or more accurately, through X-ray crystallography, and just try to figure out what on earth it did.
But that has all changed, and that's why we're here today. We aren't just watching the birds anymore.
We're building our own birds.
Yeah.
We're designing them from scratch.
It's a very poetic way to put it, but it's true. We have moved from the era of discovery to the era of design. We are not just reading the code of life anymore. We are learning to write it. And this isn't just, some kind of futuristic hype. This shift was basically cemented by the 2024 Nobel Prize in Chemistry. That was the official moment, wasn't it?
It really was.
Yeah.
That prize marked the turning point. It recognized 3 individuals who fundamentally changed the game.
Okay, so who were they?
You had David Baker, who received half the prize for his work in computational protein design. He's really seen as the father of this field.
All right.
And then Demis Hassabis and John Jumper from Google DeepMind, they shared the other half for protein structure prediction.
So one half for building them, the other half for figuring out what they look like.
Precisely. It was the moment humanity essentially got the keys to the kingdom, to the molecular world.
And in this deep dive, that's what we're going to unpack. We're going to look at the evolution of this field from the early days of basically gluing molecules together by hand all the way to the absolute cutting edge.
Which means talking about these new AI tools like AlphaProteo and RF diffusion.
Right. We're going to find out how these AI models are, and this is a word they use, hallucinating in a good way. New drugs that could cure cancer, neutralize viruses.
And maybe even clean up the environment. And they're doing it with an efficiency that was literally, and I mean literally, unimaginable even 5 years ago.
It's a whole new ballgame.
So let's start with the basics. The robots themselves. In the intro, I mentioned this idea of a lock and key. Can we unpack that?
Yeah.
Because I think that's central to understanding why protein design is so hard in the first place.
It's the fundamental concept of biology, really. In the cellular world, almost nothing happens in isolation. A biological process is usually triggered when 2 proteins physically touch each other.
Okay.
But they don't just, bump into each other randomly. They have to fit together perfectly.
Like puzzle pieces.
Exactly like puzzle pieces. Or a key entering a lock. Let's say you have a virus entering your body. That virus has a protein on its surface. Let's call that the lock.
Okay, the virus is the lock. To stop that virus, your body needs to produce an antibody. And an antibody is just a specialized protein that is shaped exactly right to be the key. It has to snap onto that viral protein and jam it up.
And if the key fits, the lock is useless. The virus is neutralized.
Correct. It blocks the virus from being able to attach to your cells and infect them. Now, nature has spent billions of years evolving these keys. Evolution is a slow, messy, trial and error process.
It just tries random shapes over and over.
It tries random shapes, and if one happens to work, it sticks around. It's this long, grinding process of optimization over eons.
But we humans, historically, we were just scavengers in that system. If we got sick or if you wanted to change a biological process, we had to go out into nature and just hope we could find a plant or a molecule that just happened to have a key that fit the lock we were interested in.
Exactly. We were totally limited to the toolbox that nature gave us. And nature's toolbox is designed for nature's problems: survival, reproduction, digesting food.
Right. Nature didn't necessarily design proteins to break down polyurethane plastic.
Or to cure Alzheimer's disease. Those are modern problems, or problems that biology, for whatever reason, usually doesn't solve on its own.
So protein design is us saying, I don't want to wait for evolution. I want to build a specific key for this specific lock right now.
That is the definition. Protein design is the process of creating new protein molecules to perform specific tasks, rather than just relying on natural variants we can find.
And this brings us to one of the most famous or maybe infamous problems in biology, the inverse folding problem.
Oh yes, the inverse folding problem.
Which sounds like a yoga move, but I know it's math, and pretty intense math at that.
It's incredibly heavy math. Think of it this way. Standard biology flows in one direction. This is what we call the central dogma. You have a DNA sequence.
The blueprint.
The blueprint. That DNA tells the cell which amino acids to string together.
And the amino acids are the Lego blocks of life, right?
Exactly. There are 20 different types of them, 20 different Lego blocks. You string them together in a long chain, sometimes hundreds of them long. But a protein doesn't just stay a chain.
It folds up.
Instantly. Because of the laws of physics and chemistry, that chain just crumples up. It folds into a complex, tangled, but very specific 3D shape.
And the final shape is what determines the function. If it folds into a hammer shape, it hits things. If it folds into a cup shape, it holds things.
Simplistically, yes. The shape is everything.
Yeah.
So the forward problem is, here's a sequence of amino acids. Predict what shape it will fold into.
Okay.
That is what AlphaFold, the tool that Vasabas and Jumper won the Nobel for, solved. It takes the sequence and predicts the 3D structure.
Okay, so that's reading the code. That's looking at the blueprint and visualizing the house.
Right. Protein design is the inverse problem. You start with the shape. You say, I need a protein shaped exactly like this to block this cancer receptor. Now you have to work backward to figure out which sequence of amino acids will naturally, on its own, fold up to create that exact shape.
And I'm guessing that's harder than it sounds, because you can't just like glue the amino acids together in the right shape. They have to want to be in that shape.
It is astoundingly difficult. Imagine I showed you a complex Lego castle and told you, write me an instruction manual that, if followed, would result in this exact castle.
Okay, I could probably do that.
But there's a catch. You can't just place the bricks where you want them. The bricks have tiny magnets and springs inside them. Some repel each other, some attract.
Yeah.
You have to lay them out into a single flat line, and then when you let go, they have to snap together purely by those internal magnetic forces to form the castle perfectly without collapsing.
Oh, wow. Okay, that gives me a headache just thinking about it. So you have to understand all the invisible forces between every single brick.
That's the thermodynamic challenge. You have to find a sequence where the lowest energy state, the most comfortable, most stable resting position for that molecule, is the precise shape you want.
And if you get it wrong,
it misfolds. It turns into a useless, tangled clump, or it just gets degraded and recycled by the cell. It's like trying to fold a self-assembling origami crane, but you only get to choose the type of paper, not where to make the folds. The paper has to fold itself.
So how on earth did we do this before AI? Because the sources mentioned this has been going on since the 70s. What did that even look like?
It was manual. It was laborious. It was what we call rational design. And we have to give credit to the pioneers. In the 1970s, you had scientists like Bernd Gutt. He was designing, reduced versions of catalysts and binders using really simple chemical rules.
Was this like pen and paper stuff?
Very much so. It was looking at the basic chemistry of the amino acids. Okay, this one has a positive charge. This one has a negative charge, so they should attract each other over here. It was true craftsmanship. It was intuitive.
And then computers started to help in the 90s.
Yes. The 90s brought the computational boom. We could start to simulate molecular dynamics. And then in 1997, Stephen Mayo achieved a major milestone, the first fully automated de novo design.
De novo meaning from scratch.
From scratch. Not just tweaking an existing protein from nature, but building a brand new one from the ground up, designed on a computer.
And then the Baker lab, David Baker, the Nobel winner, he really kicked the door down in 2003.
He did. With a protein called TOP7. This was famous because it had a folded 3D shape that had never, ever been seen in nature. It proved that we could explore parts of the protein universe that evolution had never touched.
I love that term protein universe. It implies this vast, unexplored frontier.
Well, it is vast. The number of possible protein sequences is astronomical.
Mm.
I mean, it's a number greater than the number of atoms in the known universe.
That's not possible, really.
It's true. If you have a protein that's just 100 amino acids long and 20 possibilities for each position, it's 20 to the power of 100. It's a staggering number. Evolution has only explored a tiny, tiny fraction of that space.
It's like evolution has only ever visited one small island on Earth.
And protein design is giving us a ship to sail the rest of the oceans.
So for decades, we were sailing, but it was slow. One of the sources compares it to battery design, just this endless cycle of optimization, tweaking one little thing, testing it, failing, tweaking again.
Exactly. It was battery design levels of optimization. Incredibly slow, incredibly expensive, and with very high failure rates. You essentially had to be a master of 3 different fields just to even play the game.
And the sources break this down into the 3 pillars of protein design: biology, chemistry, and physics. Let's walk through those briefly because it really highlights how interdisciplinary this whole thing is.
Right. So first, you need biology that provides the manufacturing plant. You need to understand how ribosomes inside cells read DNA to actually make the proteins.
Okay.
That gives you your building blocks and your constraints. You can't design something that the cell can't physically make.
Then you have chemistry.
Chemistry is the rule book. It explains all the little interactions, hydrogen bonds, van der Waals forces, hydrophobic interactions. You know, why an amino acid with oily properties hates water and wants to bury itself deep inside the protein.
Or why 2 sulfur atoms want to link up and form a strong bridge.
Exactly. Those are the rules of the game.
And finally, physics.
Physics is the simulation engine. It's statistical mechanics, thermodynamics. Physics allows you to calculate the energy of a particular fold. In nature, everything wants to be in its lowest energy state. It's lazy, essentially.
So physics helps you calculate if your design shape is actually stable or if it's just going to fly apart.
That's the idea. And the computational tools, like the Rosetta suite that came out of the Baker lab, were basically giant calculators trying to solve these physics equations over and over.
So Rosetta was the gold standard for a long time.
It was. It used these energy functions to try and simulate folding. But as powerful as it was still limited by our ability to model those complex forces perfectly. It was always an approximation.
Like trying to predict the weather by simulating every individual molecule of air in the atmosphere.
A great analogy. It's just too complex. You can get close, but you're going to miss things.
Enter the news peg. Enter the AI revolution.
This is where everything changes.
So we've established that designing a protein is like trying to solve a billion-piece puzzle in the dark. But now we have these AI flashlights. We have AlphaProteo and RF diffusion.
And the shift here is fascinating. We are moving from a world of simulation based on physics to generation based on patterns.
Okay, what does that mean? Is it like how ChatGPT doesn't explicitly know grammar rules, but it has seen so much text online that it just knows how to write a grammatically correct sentence?
That is a very, very apt analogy. These new models, particularly AlphaProteo, which was released by Google DeepMind, have been trained on the entire protein data bank, the PDB.
Now, what's the PDB?
That's the global repository of all known protein structures. Every single protein structure that we have ever solved experimentally is in there. It's decades of work.
Plus, the sources say it wasn't just trained on the PDB, it was also trained on over 100 million predicted structures from AlphaFold.
And that is a crucial detail. That's what created this massive, massive data set. The AI learns the grammar of protein folding. It learns that if you have this kind of shape here, you usually see this sequence of amino acids there.
So it's developing an intuition.
An intuition, if you will, that transcends our ability to write down simple physics equations. It's learning from the data itself, not just from our predefined rules.
Let's focus on AlphaProteo first, because DeepMind is making some pretty big claims. They call it their first AI system for designing novel, high-strength protein binders.
Binders is the key word here. Remember our lock and key analogy. AlphaProteo is a locksmith. Its entire job is to look at any given lock and fabricate a brand new key that fits it perfectly.
Okay, so how does the locksmith work? If I give AlphaProteo a target, say a spike protein on a coronavirus, what does it actually do?
It uses a two-step process, which is actually quite clever. First, it has what's called a generative model. You give it the 3D structure of the target lock, and you can even tell it, I want to bind to this specific spot on the lock, the hot spot.
So you tell it where to aim.
You tell it where to aim. Ideally, you want to aim where you can gum up the works, like where the virus would normally attached to a human cell.
And the generative model starts hallucinating keys.
It generates a massive number of candidate proteins. It looks at the target's geometry and its chemical properties, and it essentially sketches out a protein that should fit there, something that's complementary in both shape and charge. And hallucinating is the right word, but in AI for biology, hallucinating is a good thing if it's accurate. It's creating something that doesn't exist yet.
But just because an AI sketches it, that doesn't mean it's going to work in real life.
Right.
We've all seen AI make up facts. Can it make up proteins that just don't fold properly?
Absolutely. And that is why step 2 is so important, the filter. This is a separate scoring system. It takes all those thousands of generated designs, and it predicts which ones will actually work in a wet lab.
So it's like quality control.
It's quality control. It looks at them and says, nope, that one looks unstable, or that one won't bind tightly enough, and it just discards them. It filters the thousands of rough ideas down to just the best few.
Which saves a ton of time and money in the lab.
A huge amount. And this brings us to this incredible concept that they're talking about, zero-shot capability.
Which sounds like a sniper term.
In a way, it is. In the old days, and by old days, I mean like 5 years ago, you would design a protein, test it in the lab, find it was kind of weak, so you'd mutate it a bit, test it again.
And repeat that over and over.
Over and over. That's a process called directed evolution. It can take months, even years. You're essentially just guessing and checking, guessing and checking.
So zero shot means?
It means the design works out of the box.
Yeah.
You generate the sequence on the computer, you synthesize the protein, and it binds. First try. No tinkering needed.
That's the game changer. The DeepMind report claims AlphaProteo achieves 300 to 300-fold better binding affinities than the best existing methods.
And it's important to note that the best existing method they're largely comparing themselves to is RF diffusion.
Okay, so let's get into the drama, the battle of the algorithms. We have AlphaProteo from Google DeepMind, and we have RF diffusion, which is largely associated with David Baker's lab and the Rosetta Commons community.
It's like the Beatles versus the Rolling Stones of protein design right now.
A friendly rivalry, I'm sure.
It's a friendly scientific rivalry, but the competition is absolutely fierce. And frankly, this competition is what's driving the field forward at this breakneck pace.
So DeepMind's technical report pits AlphaProteo directly against RF diffusion in a series of benchmark tests. And they didn't pull any punches. They tested on 7 or 8 diverse targets, things like VEGF-A, which is involved in cancer, and of course, SARS-CoV-2.
Right.
What were the results? Who won the showdown?
Well, according to DeepMind's data, AlphaProteo came out significantly ahead in terms of what they call success rate.
And success rate means what exactly?
It means if you ask the AI to design, say, 100 proteins, how many of them actually bind to the target when you test them in a real test tube?
Okay, the hit rate.
The hit rate. For AlphaProteo, on these targets, they were seeing success rates between 9% and as high as 88%.
Wait, 88%? That's insane for biology. Usually, if you get a 1% success rate, you're popping the champagne.
Correct. A few years ago, getting any de novo binder to work was a whole PhD thesis. Now, AlphaProteo is claiming it can get an 88% success rate on some targets.
Wow. And what about RF diffusion in their tests?
In their comparison, they note that RF diffusion had lower success rates on these specific tests. For one target in particular, TRAA, they reported that RF diffusion had a 0% success rate, while AlphaProteo succeeded.
Ouch. 0%. That's a shutout.
It looks like it. However, and this is a very important however, you need to look at the nuance here. The source material from DeepMind itself is quite fair about this. Experimental conditions matter immensely.
Ah, the fine print. There's always fine print.
There is. DeepMind notes that their testing protocol used lower concentrations of the target protein. Now, that sounds like a really technical detail, but it actually makes the test much harder.
Why is it a harder test?
Think about magnetism. If you have a really weak magnet, it might stick to the fridge if you press it on there really hard, or if the fridge door is super magnetic.
Sure.
But if you have that same weak magnet and you just lightly toss it near a piece of metal, it's just going to fall to the floor. If you flood the test tube with tons of your target protein, that's like pressing the magnet on hard. Even a weak binder will probably stick eventually. That's an easy test.
So using a low concentration is like the toss test. Only the strongest magnets are going to stick.
Exactly. If you use a low concentration of the target, only the strongest, tightest binders, the ones with high affinity, will be detected. So DeepMind is arguing that previous benchmarks for tools like RF diffusion might have been easier because they used higher concentrations, potentially inflating their success rate by including a lot of weak binders.
So DeepMind is essentially saying, we set the bar higher and we still won.
That's the argument, yes. They are claiming their designs not only work more often, but that they have fundamentally higher affinity. And we need to talk about that metric. Affinity.
This is the picomolar thing I saw in the notes.
Yes. Affinity is a measure of how tightly something binds. It's measured in molar concentrations, and the key thing to remember is that lower numbers are better.
Okay.
Millimolar is weak, micromolar is okay, nanomolar is usually good enough to be a drug, picomolar is, well, picomolar is super glue.
And alpha proteo is hitting picomolar.
Yes. They achieved binders with affinities in the range of 80 to 960 picomolar. To give you an analogy, the difference between an anomalar binder, which was the old gold standard for a good result, and a picomolar binder is the difference between a magnet just sticking to your fridge and two pieces of metal being welded together. It's an incredibly tight grip.
And they did this without the months of optimization, the directed evolution.
Correct. And that's the other key metric. Efficiency. They screened just tens of candidates to find these winners, not thousands or tens of thousands. That's what we call medium throughput screening versus high throughput.
Which saves a ton of time, money, and resources.
It democratizes the science. You don't need a massive robotics lab to test 1 million compounds anymore. You might just need to test 50.
That's incredibly impressive, but I want to make sure we're not just, reading a press release here. Did they actually do anything with these proteins? Or are they just numbers on a server?
No, they validated them.
Yeah.
And this is where we get to the real-world applications, the killer app, if you will.
Section 5, medical breakthroughs. This is where the rubber meets the road.
Exactly. So first they tested their designs against a protein called VEGF-A.
Okay, break that down for us. What is VEGF-A and why should we care?
VEGF-A stands for vascular endothelial growth factor A. It's a protein that signals your body to grow new blood vessels. Normally, that's a good thing. If you get a cut, you need new blood vessels to heal the wound.
But there's a but, isn't there?
There's a but. Tumors hack this system. A tumor needs a massive blood supply to grow rapidly. It's like a metabolic furnace. So tumors start pumping out huge amounts of VEGF-A, essentially screaming at the body, build more roads to me, feed me.
So if you can block VEGF-A, you can starve the tumor.
Precisely. It's a classic and proven strategy in cancer therapy. AlphaProteo designed a protein binder that latches onto VEGF-A and stops it from signaling. They tested this in human cells in a petri dish, and it successfully inhibited that pathway.
It turned off the road-building crew for the tumor.
It did. And then, of course, the big one, viral neutralization. They targeted the SARS-CoV-2 spike protein.
The famous spike?
The very same. They designed binders that latch onto the spike, and they tested them in live infection assays using viral monkey cells. The results. The binders neutralized the virus.
Now let me play devil's advocate here for a second. We already have antibodies for COVID. We have vaccines. Why do we need new design proteins for this? What's the advantage?
That's a great question. Antibodies, the kind our bodies make or that we use as drugs, are large, complex, Y-shaped proteins. They're actually quite difficult and expensive to manufacture. You often have to grow them in large vats of mammalian cells. They can also be unstable. They often need to be kept cold, which is a problem for distribution in many parts of the world. These designed binders are often what we call mini proteins. They are tiny.
So they're cheaper to make.
Much cheaper, much more stable. Some can sit on a shelf at room temperature for months, and because they're smaller, they can sometimes penetrate tissues better. Imagine an inhaler with a designed protein to block a respiratory virus, rather than needing an IV drip in a hospital.
Or a pill that's shelf-stable in a rural clinic that doesn't have reliable electricity.
That's the promise. It's about accessibility and creating more robust medicines.
And this extends beyond just blocking things, right? The Institute for Protein Design, Baker's Institute, talks a lot about vaccines. They're designing self-assembling protein nanoparticles. I saw the pictures of these in the source material. They look like these perfectly geometric little soccer balls made of proteins.
They do. They're beautiful structures. And that geometry is the key. They're designed to mimic the size and shape of a virus. So what you do is you attach little pieces of the real virus, like a piece of the spike protein, to the outside of this protein soccer ball.
And when you inject it, your immune system sees it and thinks it's a real virus.
It freaks out. It sees this particle that's the exact size and shape of a virus covered in viral parts, and it mounts a massive response. But it's a dummy.
It's hollow. It can't replicate.
It's perfectly safe.
Right.
But because it presents the viral parts in such a dense, organized, repetitive pattern, your immune system creates a much stronger and more doable response than it would to just loose pieces of the virus floating around. It trains your immune system to be a sniper, not just a foot soldier.
So better vaccines, safer vaccines.
That's the goal.
But it's not just medicine, right? This is the part of the sources that really blew my mind, the environmental sustainability angle.
This is where it starts to feel like science fiction, or as you said, almost alien technology. We are talking about designing proteins to solve problems that nature never ever had to solve.
Like plastic. Evolution never had a reason to design a protein that eats plastic.
Exactly. Plastic has only existed for a blink of an eye in geological time. There's been no evolutionary pressure to deal with it.
So we can't just go out and find a plastic-eating enzyme in the wild.
We can find some very weak ones in bacteria that happen to live in trash heaps. But they're slow. They evolved just enough to survive, not to efficiently process tons of recycling for us.
So with protein design,
We can take the active site, the little part of the protein that does the chemical chewing, and we can redesign the entire protein scaffold around it to make it super stable, super fast, and super efficient under harsh industrial conditions like high temperatures.
we can build a custom-designed stomach for eating plastic.
Or for capturing carbon out of the atmosphere. Or for breaking down those forever chemicals, PFAS, in our water supply. The insight here, the big takeaway, is that we are no longer limited to the toolbox that nature gave us 3 billion years ago. We are forging new tools for the Anthropocene.
That is such a powerful thought. Tools for the Anthropocene. We've changed the planet, so now we need to change biology itself to fix our mistakes.
That's the potential. But we must also address the limitations. We shouldn't make this sound like it's magic. It's still engineering, and engineering is hard. There are failures.
Right, the sources were very honest about the failures. DeepMind admitted they failed on one of their targets.
Yes, a protein called TNF-alpha, tumor necrosis factor alpha. It's a well-known but very difficult drug target. And AlphaProteo couldn't find a binder for it. It failed.
Why? If it solved all the others, why did it fail there?
We don't know for sure yet. It might be something about the geometry of the binding site. It might be that the target itself moves around too much. It's too floppy. Proteins aren't rigid statues. They vibrate and breathe. If your target is shape-shifting too quickly, it's very hard to design a key that fits it consistently.
So it's still science, it still involves failure and learning.
Absolutely.
Yeah.
And there's still a data constraint, right? AlphaProteo and these other tools generally rely on knowing the 3D structure of the target first.
You need the map of the lock before you can design the key.
Exactly. If we don't know what the target looks like, we can't design for it yet. Now, the good news is, with AlphaFold, we are getting much better at predicting the structures of those targets too. So the two technologies feed into each other in a virtuous cycle.
And what about the safety aspect? I saw a tab for responsible AI on the Institute for Protein Design website. That's always a bit of a warning sign.
It's the double-edged sword of any powerful technology. If you could design a protein to selectively bind to a cancer cell and kill it.
Could you theoretically design a protein to selectively target something else? A healthy cell.
A weapon. Biology has always been dual use. The same technology that makes a better vaccine could, in theory, be misused to make a more potent toxin. That is why the field is heavily focused on a responsible development.
So what does that look like in practice?
It's why access to some of these most powerful models is controlled, and why many services that synthesize DNA sequences for you will screen them against known hazards. We need to build guardrails to ensure these tools are used to tackle disease and pollution, not to create new dangers.
It's the classic Spider-Man rule. With great power
comes great responsibility. And this power is growing exponentially. We are seeing what the sources call the generative shift. Just as generative AI creates images or text, it is now generating actual biological matter.
And DeepMind's vision is that AlphaProteo, as good as it is just the first step.
Yes. Right now, it's just designed to make binders, things that stick to other things. But proteins do so much more. They catalyze reactions, they transport molecules, they act as motors. The ultimate goal is to generalize this generative AI to design a protein for any biological interaction you can imagine.
Imagine designing a protein that acts as a logic gate, a tiny biological computer inside a cell.
Or a protein that can harvest sunlight more efficiently than any plant to make clean hydrogen fuel. The possibilities are, as the cliché goes, endless. But in this case, the cliché is mathematically true. The protein universe is, for all practical purposes, infinite.
So let's bring this deep dive in for a landing. We have covered a lot of ground today.
We have. It's a very dense topic.
We started with the idea that we are all made of tiny robots' proteins. We talked about the fundamental lock and key mechanism of biology. We looked at the history from the painstaking manual work of the 70s to the computational boom of the 90s.
And we arrived at the present day, the 2024 Nobel Prize, which officially recognized this massive shift from just reading the code of life to actually writing it.
We unpacked alpha proteo and RF diffusion. We saw how AI is using this concept of inverse folding to hallucinate brand new proteins with picomolar affinity, that's superglue level stickiness, without needing months and months of lab testing.
And we saw the real-world proof, stopping cancer signals in a dish, neutralizing COVID in a lab, and the incredible potential for next-generation vaccines and environmental cleanup.
So what does this all mean for you, the listener? Why does this matter to someone who is, just driving to work right now?
It means that the next time you get sick, the medicine you take might not be something that was discovered in a rainforest or synthesized by trial and error in a chemist's flask. It might be something that was dreamed up by a GPU in a server farm.
It means that medicine is becoming an information technology. And just like all information technologies, it is going to get faster, cheaper, and better at an exponential rate.
We are transitioning from being merely the inhabitants of the biological world to being its architects.
That is a staggering thought. And I want to leave you with one final provocation to think about. We've talked today about curing diseases and fixing the environment. And that's all about, repairing the house that we live in.
Right.
But if proteins carry out all the jobs in living things, and if we can now design proteins at will to do anything, we aren't just practicing medicine or engineering anymore. Are we essentially rewriting the operating system of life itself?
That is the question of the century. If we can write the code, what story do we want to tell with it?
Something to mull over. And hey, if you have a moment, go check out the sources we've linked in the show notes. Specifically, look at the images of these designed proteins. They have this strange alien beauty to them. They don't look like nature's messy, evolved scribbles. They look like pure geometry. They look like the future.
They really do.
Thanks for listening to The Deep Dive. We'll see you next time.
Goodbye.